Can you send the next patient through, please? Thank you. Hello, lovely. Come on over and take a seat. How are you? Good. Yeah, I'm very well, thank you. So, I've got you in for a health check today. Great. Can I just confirm your full name? Thank you. And your date of birth? Perfect. Right, have you brought a urine sample with you? Perfect. Can I take that from you? Thank you. I'll just pop it on there and I'll check that later. So, how are things? Any concerns or anything I need to be made aware of? Right, okay. Let's just have a little look. And how long has that been there? Any size or shape change or anything like that? Okay, well, what I will do is have a closer look for you in a little while. Alright, so don't worry about that. Okay, but we're going to start with the health check, if that's alright with you. Perfect. So, I'm going to start by having a listen to your chest. Alright, so if you can just raise your top for me, and if you can just breathe normally for me, that would be really good. Alright, thank you. Hopefully it won't be too cold for you. Right, okay. Yeah. It sounded nice and clear. What I like to hear. Good. Perfect. So listen to your heart. Normal breathing. Great. Excellent. Pop your top down. That sounds really good. Great. Okay, so this just monitors your pulse and your oxygen levels, alright. So what I need you to do is pop in your index finger for me. Okay, there we go. Let's keep nice and still for me. Wonderful. Fantastic. Nice and stable, good rate. Fantastic, that's really good. Thank you. Perfect. Let's do the blood pressure. Let me just check when they last took blood pressure for me. Okay, so the last time you were here for the health check, so about a year ago. All right. Okay, if I can take this arm. Okay, so I'm just going to pop and tighten it up. Okay, we just pop your arm just on there for me, okay? And just relax. Keep your feet nice flat on the floor. Start going tight now. Yeah, sometimes it can be a little bit unpleasant, but it's fine. Good. Okay. That's really good. That's great. Just take that off you. Perfect. That's really good. So, I'm just going to have a little look at your eyes, okay? Have you been experiencing any problems at all with them? Great. And are you all up to date with your eye examinations? Perfect. So, if you can look straight ahead for me at my nose, whichever is in view. Okay. Right, let's have a look. Yes, it's very bright. Okay. Good. Great. Just look up for me with your eyes. And back. They look nice. Some white. Pupils seem to be retracting perfectly. Okay. Perfect. They look really healthy. Okay. Just going to have a little look in your ears, alright? Any problems with your hearing? Okay. Any ear pain? Good. Okay, just going to go in now. So that's nice and clean, healthy. Wonderful. Other side. Okay, pop it in now. Okay. Nice and clean and healthy too. Wonderful. Okay, so I'm just going to have a little look in your mouth. Alright, and then I'll check your urine. Okay, if you can just open wide for me. Okay. Have you been going to the dentist regularly? Good. Any problems with your teeth or gums? Great. Do you get any ulcers regularly or anything like that? Okay. Just say R for me. Good. I'm going to pop this in now. Alright. Right down. Say R. Good. And again. Don't we get any sore throats or anything? Perfect. Looks really healthy, clean. Yeah, perfect. Okay. Wonderful. Okay. Right, I'm going to have a little look at the freckle at the moment first, okay? Then I'll go on to the urine. Save me changing gloves. Okay. Do you suffer with pigmentation normally, or freckles, moles? Okay. Ever had history of problems with freckles, moles? What about family members? Okay, that's good. Right. Let me just have a look first with my light, alright? Okay, I can see that. So it feels quite smooth, but see the slight irregularity around there. Any itching or pain from there? Any oozing or anything? Okay, good. I'll just have a quick look at the rest of your face just to see if there's any pigmentation going on. I can see a little bit of hyperpigmentation. Alright. Do you burn easily in the sun or? Alright. Okay. Closer look with this, alright. Yeah. Okay. I don't think it's anything to worry about, but I'm not a specialist, okay? Yeah, so I think the best thing is if I refer you on to a specialist. Alright, they'll be able to really assess the skin and the area and things like that. No, please don't be worried. You know, I think it's best to just get it checked out on the safe side. I mean, you came here and you mentioned it to me, so I think it's only right that just to be on the safe side. Alright, you're very welcome, but I'll book that for you in a moment. Okay. Right. Any problems with your waterworks? What about your bowels? Okay, I'm just going to pop that there and let that do. How's your mental health? Is it alright? Okay, medication? Good. All doing alright at home? Perfect. Okay, let's check. Nice and clear. That's perfect. Wonderful. So that is all done. Just going to quickly check your temperature. Okay, right. Good. That's fantastic. No problems there. So, see, and the area between okay, I'm just getting up the system now. Okay, so I have an appointment with Doctor Lavender. All right, I know, lovely name. And I can get to you in a little bit later on if that's all right. Yeah, that's right. Yeah, that hospital. Okay. Okay, that's all done. Can you just confirm your telephone number? Good. Right, you should get a text now with your appointment. Good. So that's all booked in for you today. All right. Yeah, that's fine. Just, tell your concerns and she'll have a good look for you. All right. But like I say, I'm sure it's nothing. All right, my lovely. Well, your health check is perfectly fine. I'm very happy with how you are. You're doing really well. All right. You're very welcome, my lovely. All right. So I'll see you soon for another checkup. Okay. Any problems, please just contact me. All right. Well, yeah, that's right. Okay. Well, thank you for coming in, and Dr. Lavender will sort you out. All right. You take care now. Bye-bye.
Yeah. Hi, I'm Dr. Lavender. Nice to meet you. So I see that you were referred here by Dr. Nick for a concern about a molar freckle on the face. Okay, well that is my area of expertise, so we can get started as soon as I confirm your first and last name. Okay, and your date of birth. Perfect, so I am talking to the correct person. So, tell me a little bit about this freckle you have some concerns with. Okay. So it's been changing in size a little bit. Okay. Have you seen a dermatologist before about any skin concerns? First time? Alright. Well, I can definitely take a closer look. Let me just finish checking you in and then we can get started. Let's pull up this online portal. Home address. Okay, we do have a phone number here for you. Is that the same? Alrighty. Same pharmacy. Okay. Are you on any medications? Alright. How would you describe your skin? Is it dry? Do you have any problem areas besides the freckle you have a concern with? Beautiful. Alrighty. Well, let me get my gloves on. So there are a few things we want to keep an eye on with regards to changing freckles or moles. Do you know the ABCDE rule for melanoma or skin cancer? So A is asymmetry. You want to make sure that the molar freckle is the same, it's symmetric. B is border. We want to make sure the border of the mole is complete. It's not missing pieces or irregular or blurred at the edges. And then C is color. Now that's if the color is irregular, it's got patches of color in it, it's maybe a weird color like red or blue. So we want to look for signs of that. So that's A, B, C, and then D, diameter. We start to be a little concerned once a mole is larger than about the tip of an eraser pencil. The eraser of a pencil, excuse me. So that's about a 1/4 inch diameter. And then lastly, E, evolving. So that is if it is changing or evolving in any way, growing really quickly or anything like that. Also, if the shape is maybe longer, stretching, rather than a nice little circle, we want to maybe check out that. Alright. So, I have permission to touch you, correct? I'm just going to get a little closer. Okay. So I see you have a couple freckles on your face. Normally somebody who has a large amount of freckles or moles is going to want to come into a dermatologist's office maybe every 6 months. And then if you have a history of melanoma, every 3 months. Yes, that's correct. It's pretty often, but us dermatologists are really trained in knowing what to look for. And we also keep a detailed log of all of your moles that we have concerns with, so we can see if they're changing through our pictures. Exactly. And if you decide to change dermatologists, we can send those pictures to your new dermatologist. Alright, so I see the one you have a concern with. I'm actually going to look at it a bit closer with a magnifying glass of sorts. So this will zoom in so I can get a really good look at it. I'm going to touch your face. Is that okay? Alrighty, let's see. Well, good news. I don't think we have to perform a biopsy or even send it for testing. I think it's just a normal freckle. Of course, if it changes anymore, anything that gives you concern, you can always visit again. And of course, we can take another look. But no, I think this one is perfectly fine. I actually have a freckle myself that is growing a little bit bigger, but completely fine. The skin, as we age, can actually change quite a bit, including our freckles. So I'm just going to take a look at a few more around your face, if that's alright. Wonderful. So, okay, so I'm just taking a look here. And if you have any on your hands, arms, legs, anywhere else, I can of course take a look as well. Yes, actually, a good dermatologist is going to look everywhere for moles and freckles that are changing. I do mean everywhere, including in your hair and everywhere. So we just really don't want to miss a mole just by being not thorough. So we're not here for a full body consultation, just simply this one on your face there. But of course, if you're looking to set up a reoccurring dermatologist consultation every 6 months, I think that's a really good idea. Okay. So you have one on your shoulder. Let's see. Okay, so it's got a complete border. It's got a good color, and it's a perfect circle. So I think that one's okay. And this one up here also has a good color. It's a good size. It's maybe a little bit on the large side, but that's not a problem. Everything else about it looks good. Okay, so I'm just going to take a picture just with my phone of that freckle on your face, and I'm going to send it to my assistant, who will start keeping a file on you. Wonderful. Okay, so just relax the face. I'm only zooming in there. Alright. Wonderful. Well, we have that on file. Let's see. How much time do you spend outside? Okay. Do you wear sunscreen? Yes? Okay, good. So you know how dentists are always telling you to floss. Well, dermatologists are always telling you to wear sunscreen. It's one of the best things that you can do for your skin, both for wrinkles and for skin health. Of course, the ideal situation is to be avoiding intense sun exposure in the first place. So if you can, buy a big hat when you go out, one that also protects your neck. Maybe rather than wearing a tank top when it's hot and sunny, wear a very thin, loose-fitting long shirt to protect your skin. So I'm actually going to recommend you some extremely high-quality, dermatology-approved sunscreens. Let me show you. So the first one is Photo Protector Istin, and it is a transparent spray with 50 SPF. You're still going to want to apply it every 2 hours, but it is a spray and it goes on sheer, not white. So I would use this for your body and for your face. Tizo 2 non-tinted SPF 40 primer and sunscreen. Once again, apply at least every 2 hours, maybe more if you're swimming, though they are both pretty waterproof. So this is for your face and the other is for your body. So if you want to talk to our receptionist right outside, you can go ahead and buy them from her, though you may be able to find this at a CVS or Walgreens as well, I believe. Okay, so I'm just going to continue looking at any areas of concern that I might have. I might take another picture. Like I said, we're mainly focusing on a face, neck, and maybe arm exam right now. Another thing to keep an eye out for is if the freckle or mole is scabbing or bleeding or really itchy. You haven't experienced any of that, right? Okay, good. So what do you do for your hobbies and for work? I'm just asking to kind of get a better gauge of how much time you're spending in the sun. For example, if you are a construction worker, or maybe you play soccer or something like that, tennis, where you're outdoors a lot, you're going to want to really pay attention to your skin. Okay. Okay, so not an extreme amount of outdoor exposure. Wonderful. So I'm actually going to take a picture of this mole on your neck, but simply to record it. I think it's perfectly fine. We just like having the beginnings of a complete file on you. Okay. Okay, maybe the one right there. Alright, so I'm sending that to my assistant, and she will put that under your name. I'm just going to check through your scalp. Alright, let's see. Okay, it looks like you don't really have any moles in your scalp. Just kind of doing a really thorough check over here. Okay, looking good. I think that one maybe needs like, no, that's good, okay. Okay. Wonderful. Alright, your scalp looks good. I'm actually gonna kind of move your eyebrow around and see if there's a freckle or mole hiding in your eyebrow. Okay. Perfect. Perfect. Let me just smooth those back again. Alright. So, looking good. Wonderful. Well, I'm just going to write down a few notes if that's okay. So you don't really play any outdoor sports? And just double checking, no family history of melanoma. Okay, can you tell me more about that? Alrighty. Well, I think we are very close to being done. No more areas of concern that you have. Yeah, so regarding that freckle, if you feel concerned, maybe in a month or so, like if it starts becoming itchy, you can come back and what we can do is scrape very painlessly a little tiny bit off of the top of that. And we send it to our lab, and about in a few days, we'll know if there's any issues with it. Okay, so what happens if we do find something? We actually just remove the whole mole. Correct, exactly. So we would apply some anesthetic, make sure you don't feel a thing, and we would just remove the mole. And it would be typical wound care. Exactly. Just have to keep a bandage on there for a few weeks. And no exercising or anything if you use that part of your body. Exactly. Okay, well, one last thing I'm going to do is just press on your face and you tell me if you feel any tenderness, okay? Nothing? Wonderful. Alrighty, well, let me just jot that down. Now, this doesn't have any major family history. No outdoor activities. Well, if you'd like to come back, you can just meet with our receptionist at front and she'll give you all of our contact information. We actually have a new online portal where you can just make your appointment with us. Exactly. I trust you didn't have too much trouble making this appointment. Oh, Dr. Nick made it for you? She's a great doctor. Excellent. Well, she's always referring people to me. We're friends outside of work. Okay, well, it was great meeting you. Let me get these gloves off so I can shake your hand. Okay, well, it's nice meeting you. I do hope to see you again if you decide to start setting up a every 6 months appointment. Wonderful. All right, well, until next time.